morning. We're here at FMCCE, the last day over in Orlando. We're here till about noontime. If you're still in the Orlando area and looking to do something this morning, stop on by. Got a nice exhibit area. The main sponsor for the event, the premier sponsor, is Trulieve. And unless you live under a rock, you know who Trulieve is. So I want to introduce you to their medical director, Dr. Terel Newton.
All right, great to see you
Good
again.
to see you again. We run into each other quite often at these events, different events.
Yeah.
A great individual. Not
Thank
only is he with Trulieve, but also practicing medicine on a full-time basis or whatever, and also, and we'll talk a little bit about the charities that you're involved in too.
Awesome.
So tell us a little bit
Thank
about
you.
yourself.
Thank you. Well, I am a board-certified anesthesiologist and an interventional pain physician. My practice consists of helping patients by doing different procedures for pain control. So those are things like epidurals for sciatica, nerve blocks injections, spinal cord stimulators, which is a device for nerve damage and nerve injuries, and also have various research projects that I discuss at various conferences and events.
Yeah, and this morning, if you are a physician, you were looking at this, you made a big mistake by not coming here.
Yes, yes.
Made a big mistake by not coming here. There are over 100 doctors, medical marijuana doctors here, one of the biggest events for physicians. And we have Trulieve talking about their products with the docs this morning too.
Yeah.
That's what Dr. Newton's going to wind up doing a little bit later on.
Right, so before I was a medical director here, I was a recommending physician. So in Florida, you can, as a physician, you can get a certification to give recommendings for patients for qualified conditions. And so we have a list of 13 conditions, and coming to conferences like these made me just elevate my knowledge much faster. And there is a learning curve because cannabis, as far as medicinal applications, is not really taught in medical schools, not taught in residency. So you could be complete with your education and actually be practicing medicine but not get much knowledge about how to apply this useful tool for patients. And so in Florida, most of the patients have either PTSD or some form of chronic pain. Unfortunately, many of the patients have cancer or nausea and vomiting related to cancer, and also a lot of side effects from cancer treatment.
Sure.
So here, we can all collaborate as physicians and have different presenters on their specialty and talk about what we can do for patients. So yesterday, I talked about medical cannabis applications for neuropathy, which is nerve damage, for fibromyalgia, which is basically, it's like a muscle sensitivity syndrome, and also migraines. And for some patients, they have an endocannabinoid system deficiency, meaning that the cannabis in the body is low. And so if you can replace that with low dose cannabinoids, or sometimes medium dose, you can help the patient get significant benefit without side effects.
So it's kind of regenerating what you already have in you.
It's regenerating what you already have in you, but over time, let's say when we get to our 40s or 50s, it starts to drop in a lot of patients. But if we can bring that up with what we call the phytocannabinoids, we can elevate our endocannabinoids to a more normal level. Most patients don't want to feel high. They don't want to feel euphoria. They don't want to feel a certain type of way. They just want to feel normal, and what we call homeostasis. And that's what the medicine can help them do.
Right. And that's one of the misconceptions from a lot of physicians that may want to get into it, or patients, that they think you have to wind up getting high to be able to take this medicine. And the answer is you don't have to. It's truly from the standpoint of, and I'll tell you, it's a medicine. You know, it has other properties to it, but foremost, it's a medicine.
One interesting thing is that most of our medicines already come from plants.
Right.
And if we think about, just throughout medical history, there was a time period where physicians could actually prescribe this, and this was in the early 1900s.
Right.
It was in our pharmacopoeia books, but because there can be some side effects there, with any substance you could be addicted. You could be addicted to caffeine, you could be addicted to sugar, but it got rescheduled, so meaning it got placed in a category where it's categorized as more addictive than cocaine.
Right.
But everyone knows that's not true. So even throughout that time period, there has been certain other divisions of the government that have proposed research studies. So our National Institute of Health actually has a patent. It was granted in 1999 on the cannabinoids to protect the brain from traumatic brain injuries. Now, this isn't like THC that can cause like dizziness and things like that. It's on things like CBD, CBG, what we call non-euphoric cannabinoids. So we've still been studying it, but it's becoming much easier because more states are getting, or they're passing cannabis laws. Some of them are passing like low THC cannabis, and some of them are actually having full-blown medical marijuana with no limits on the THC dosage.
Yeah, it all around what you're finding, I guess, in the state right now, is that the elder population myself, you find
And pre-elder population can
pre-elder
both benefit.
pre-elder population, that those are, people think, well, it's really just a younger generation. The truth of the matter is, there's a high concentration of older population moving off of the pharmaceuticals, and getting into either medical marijuana or a regimen of CBD on a daily basis, and it's really helping them in the long run.
It's making such a big difference. Actually, what you just mentioned made me think of a study I recently read. So this is a database of 12 million patients out of New York. And so the most common conditions that they had were chronic pain, neuropathy, and cancer. And there was another group that was, so that group was like 60 and older. There was another group that was 45 and younger, and so they had chronic pain also. They also had neuropathy, and then they had IBD, so they had inflammatory bowel conditions. And so why can one medicine help with so many different conditions? And one reason is because cannabis isn't just one medicine. So it's a combination of what's in the plant. So you can have 5 anti-inflammatory cannabinoids, so that's like THC, CBD, and related compounds, and you can have 5 anti-inflammatory terpenes. So terpenes are what gives fruit its color and flavor, is what gives vegetables their color and flavor. So there's really no other medicine that where you could have 10 anti-inflammatories in one particular product. So cannabis is very versatile also because you have something called sativa and you have something called indica. So they can give a variety of side benefits, not side effects, but for side benefits. So with the indicas, it can help patients relax, it can help them sleep. It's very good for migraines, it's very good for pain, especially at night. And they have sativa, which can also help with pain, but it can be more uplifting. So it's something that the patient can take more in the daytime, more in the midday.
Right. And Trulieve as a company, as I guess one of the first, or the first medical marijuana company in the state of Florida, obviously has the biggest footprint in the state of Florida, but really concentrates on putting out products as well for the patient's needs, and constantly doing research. I know they work with you, Dr. Terel also, in developing products that will help the patient. Not everyone you have to get them out, not just getting high, but truly helping the patient get through a variety of different conditions that they may have.
One of the most wonderful pleasures that me and Dr. Terel have is actually learning from the patients, is getting that feedback of what's helping, what's not, also getting the feedback from the physicians. You know, because once, I'll tell you this, when I first learned how to do recommendations, most of my learning was from the patients. There's not, at that time, wasn't much data out there. So so I'm talking about 2010.
Right.
And the patients, when they keep their journals and they can come in the office and tell you, this is what worked, this is what didn't work, that's another lesson for the doctor. So you have to be humble to listen to the patient, as with any condition, no matter what you're treating, what you're looking at, but then also you have to do the research. So in the US, there's been an exponential increase in research studies published because so many more states has it available. So now there is research to back up the recommendation.
When it first came out, there really was, I mean, you know, 6-7 years ago, the research was very minimal.
It was very minimal, but we knew throughout history that cannabis was helping, but we didn't know why. But now we know why, because in the 1990s, you know, I want to say rest in peace to Raphael Mechoulam. He discovered the endocannabinoid system, that we have this cannabis in our bodies. And then since then, we've had more and more studies that can help us decipher the mechanisms. So it's been around for centuries. We didn't know why it was helping. We knew it was helping, but now we know the mechanisms and the science behind it.
So with that, I want to, because I know you have to go teach a little class over here for a second. So tell us a little bit about the work you're doing outside of Trulieve and the foundations that you're supporting, because we were just talking about this earlier before we actually went online. And it really is a wonderful situation that you're doing, and how it has grown over the years. So tell us a little bit about that.
Thank you. So there's actually 2 big events I'd like to mention. One is next month in July. So this is a celebrity basketball game, and also—
And this is July 2023. So.
Correct. And so we're actually adding also a flag football game and a student empowerment day. So the purpose is to raise awareness about mental health disorders and raise funds for kids in Miami-Dade County to have mental health resources. So they don't have to pay anything out of pocket. They just have these resources available for free. So it's going to be July 20th, 21st, and 22nd. The day that I'll be doing the Empowerment Day will be on that Saturday. I believe it's the 22nd. And then the following month after that, in August of 2023, August 14th to the 17th, at Orlando SeaWorld Renaissance, there's a Paralyzed Veterans Conference that's going to be there. And so I'll be speaking to the Paralyzed Veterans Association about cannabis and how it can help veterans with spinal cord injury. So I'm very much looking forward to that.
Yeah, you have your not only that, but he practices medicine on a full-time basis. So.
And yeah, I love it every day.
And he gets around the state and supports Trulieve and other operations. So. So if you're in the area, how would people if they wanted to get a hold of you?
Yeah.
Is there an email or something or something?
Well, you can actually go to my website and there's links to Trulieve. There's links to the other events that I do. It's terelnewton.com, TerelNewton.com.
Yeah, a wonderful individual, and he's given two presentations to the doctors in general here, and now doing one on what I would call like a private seminar.
Hey, absolutely.
For the doctors. But understand that if you really didn't come out this year, whether you be a doctor, a patient, or just somebody interested, you made a big mistake. And look for us next year.
Absolutely.
It'll be bigger and better. And if you're out and about and want to learn a little bit more about cannabis, obviously see a medical marijuana physician. And if you're looking to buy products, Trulieve is around. It's got to be around the corner from you someplace.
Yeah.
Have 125 locations. It's got to be around you.
Throughout the state, and also have locations in Georgia as well.
Yeah. For those who could see this, you're opening up in Georgia now. You have one. First operation is in Marietta, and there'll be one coming soon to Newton.
Well, this will be great for the patients that travel back and forth. Some patients you have that live in Georgia and work in Florida, or vice versa. And some physicians that are practicing medicine in Florida and Georgia. So I think it's great to have that continuity of care and treatment.
Yeah. Although the programs are not exactly the same, maybe one day they'll kind of equal out. But it's getting close.
They're getting closer. There is some. You're 100% correct. There's some overlap in products, but the main thing is that we're here to educate. We're here to advocate for patients, advocate for doctors, and this is a wonderful medicine that I'm hoping everyone gets a chance to learn about and see if it's good for you or good for a family member.
Yep, absolutely. And any other questions, you can always look us up on our website. We have a wonderful resource of information, different articles, videos from the leadership in the cannabis industry. Dr. Newton, thank you much. I appreciate you stopping by this morning.
Thank you so much. I really appreciate you.